Informational meeting of the House Children and Youth Committee in order. Just a reminder that this meeting is being broadcasted and recorded. Please make sure your cell phones are silenced. I ask that members use the microphone when speaking and make sure that the green light is on. To get started, I would like to ask Stacy to please take roll.
Chair McNeil, Representatives Bellman, Boyd, Serrato,
Leave.
Curry, Fleming, Genst,
Here.
Hambidge,
Leave.
Howard,
Here.
Kazim, Krajewski, McAndrew,
Leave.
Nelson,
He's online.
and Powell.
Leave.
Chair Joswiak,
Leave.
Representatives Fink,
Leave.
Flick,
Leave.
Grim-Krupa,
Here.
Hogan,
Leave.
McKenzie,
Leave.
Allsummer,
Leave.
Rossi,
Leave.
Schlegel, Watro,
Leave.
and Zimmerman.
Leave.
You have a quorum.
The purpose of today's informational meeting is to provide members with information on findings related to both the CCAP Complex Case Task Force Report and the DHS Blueprint Report. Chair Cripple, would you like to make any opening remarks?
Thank you, Chairwoman McNeil. As a member of this committee, I've learned a great deal about how our child welfare systems work within the state. Helping the children of our state is admirable, but it's difficult and it's stressful work. Helping children with complex needs takes that work to an even higher level that requires multi-agency involvement with knowledge and experienced staff. Thank you to the testifiers that are here today. I look forward to hearing the testimonies from the CCAP Complex Case Work Group and the results of their work. Thank you.
Thank you, Chair Kripa. Today we are joined by the following speakers: Jean Foshee, Cumberland County Commissioner, County Commissioners Association of Pennsylvania; Brian Borman, Esquire, Executive Director, Pennsylvania Children and Youth Administrators, County Commissioners Association of Pennsylvania; Jonathan McVeigh, Special Assistant to the Secretary, Complex Needs Planning, Pennsylvania Department of Human Services. We will begin with the Honorable Jean Foshee, Cumberland County Commissioner, on behalf of the County Commissioners Association of Pennsylvania.
So before I get started with the nitty-gritty here, I want to make it very clear how much we need you and how much counties need you, because the situation with complex cases has become untenable for counties. We need your help so that we can continue to do the good work of preventing problems and protecting children. The cost of not helping children is insurmountable, and it crosses everything we do in government, whether it's state government or county government. It crosses absolutely everything we do. Think about workforce. Think about small businesses, the 911 system, our police officers, our first responders, our court system, our prisons, our schools, the cost of not getting a good education, our families, and at the end of the day, it's our humanity. Right? But I don't know that humanity is attractive to anyone anymore. So I'd like to, as you contemplate this, think about those costs. Think about what they mean. So I took office in 2020, and I am proud to serve as the Commissioner Liaison on our Children and Youth Advisory Committee, and I am also honored to be a member of the CCAP Complex Case Work Group. But more importantly, I am a mom to 2 boys, Leo and John. And I know the difficulties and the joys of raising children and taking care of a family in our complex world. It is with a heavy heart that I sit here before you today to discuss the challenges counties face in caring for our most vulnerable youth. We spend so much time in the trenches of complex care that we cannot engage in the work of prevention. Our current system has created an environment where our professionals don't get the opportunity to work with families at the onset of problems. This leads to troubles, years of escalating behaviors that leave families worn out, desperate, and torn apart. I hope my testimony today brings light to the plight of children and families and provides positive steps going forward. We need you. You have all the power, all of the authority to fix this. We need you. We need your help. So the CCAP Complex Case Work Group was formed and worked on many of the aspects of the report we've shared with you in 2023. There was already a crisis in serving dependent children with complex behavioral health needs. We centered our work on children who need the highest levels of behavioral health care, potentially coupled with other physical health needs as well. For these children, counties are routinely unable to find any appropriate treatment setting to meet their needs. So children and youth are sleeping in children and youth offices or hotels, or they're having long hospital stays well beyond when they should be in the hospital because there is nowhere that meets their needs. There's nowhere for us to send children that need complex care. And this is not unique to any one county. In the first 6 months of 2023, 45 counties reported having 225 children sleeping in their offices or a hotel for 772 nights. Since 2023, this has gotten worse Commonwealth-wide. Our report provides many other concerning statistics that I urge you to read and consider while contemplating action desperately needed. Remember, we need you. We need you to help us with this. In Cumberland County, when a child must be held in our office overnight, we staff the office with 2 children and youth staff and 1 sheriff. The cost per night for the county for salary and benefits for those 3 people is over $2,200 per night. In one of our shelter facilities that will take a complex youth, the routine cost is $785 per day. If the child has increased behaviors, they request additional staff payment of $500 per day, bringing the cost over $1,285 per day. For some children, they need to provide even more support. Just 1 child can cost over $2,000 per day in a shelter and not, I repeat, not receive any therapeutic services. These costs continue to rise even as we work on proactive steps out of this crisis. Remember, we need you. You have all of the power and all of the authority to help us fix this. While our work group focused on the dependency system, the lack of appropriate and timely treatment services is also felt in the delinquency system. Due to the lack of resources in our private providers, the state secure system is our only option. That placement puts delinquent, complex youth among serious offenders, which is often not an appropriate option, but it's the only way to get these youth treatment. The per diem for our state secure placement is $975 a day. This is an average cost of around $200,000 to the county, Cumberland County, and the state per youth. So think about that. Think about how expensive that is and how much easier and less costly it would be to prevent these problems. Save taxpayers tremendous money in the long run. It would save all of us tremendous work in the long run, and it would really save our children and unite our families. And we need that in Pennsylvania. We need that to thrive. We have seen an increase in youth that fit this mold and are placing 2 to 3 delinquent youth per year state secure because we have no other treatment options. So what am I going to say to you right now? We need your help. You have all of the power and the authority to help us with this. The fiscal impacts on counties are enormous. However, the costs are really the negative impacts on these children and their families when they are not receiving much needed treatment that is necessary to stop a downward spiral and potential future issues when they reach adulthood. County agencies are unable to focus on preventative work. to support families when we are spending most of our time trying to locate a placement for our youth. So instead of working on prevention, family connections, and comprehensive plans for treatment, Cumberland County's Children and Youth Director regularly makes calls to facilities to support our staff in locating a placement. There are children that there is no one in the United States that will take them. No one. We have identified several recommendations for the House Children and Youth Committee to consider that would address the immediate crisis, and we urge you to act decisively and swiftly so our good work in helping children and families can continue in a meaningful and productive way. Our primary recommendation is to develop a no eject, no reject program to ensure that every youth has a safe place to stay when there are no other options. Safe place to stay when there are no other options. Unlike the state secure youth detention center, and youth detention facility for delinquent youth, we lack a not secured, no eject, no reject placement for dependent youth. You have the ability to fix that. We need you. A diagnostic or stabilization program would fill in the gaps in the system to offer a safe program for children until a long-term program could be identified for them. Having these programs be regionalized will also benefit youth by allowing them to be closer to family and avoid extensive travel costs for treatment. There it is, that uniting of the family, right? If we have a youth in Cumberland County and we have to send them to Ohio, there's no way that their family can see them, right? It's tough, really tough on families. The CCAP Complex Case Work Group report contains additional recommendations we would be happy to discuss with you, and we appreciate the time that you have allowed for me to have this discussion, for CCAP to have this discussion, and look forward to answering your questions. And remember, we need you. We are so looking forward to an excellent partnership to solve this problem. Thank you.
Thank you. Next, we will hear from Jonathan McVeigh, Special Assistant to the Secretary, Complex Needs Planning, Pennsylvania Department of Human Services.
Good morning, everybody. All right. Good morning, Chair McNeil, Chair Joswiak, Chair Hanbridge, Vice Chair Zimmerman, and members of the House Children and Youth Committee. My name is Jonathan McVeigh. I'm a Special Assistant to the Secretary on Complex Needs Planning in the Department of Human Services, and thank you for inviting me here today regarding the Blueprint Work Group report. There is a slide deck that I think you all should have access to, and it looks like it might be buffering there. Today I'll address a little bit of the background of this initiative, an overview of the goals, the timeline of this work group, and the recommendations. I'll give some samples. There are 18 recommendations, and so not quite enough time to cover them today. And then also outline some next steps, and time permitting, share other news from the department regarding the Pediatric Capacity Building Institute. Before we get any further, I want to talk a little bit about who we are trying to support with this effort, who CCAP's supporting, who the Blueprint Work Group is focused on. It's an attempt to try to more clearly define and articulate these youth with complex needs. What do we mean by that? On slide 4, you'll see a bulleted list of characteristics. These are the most often encountered characteristics that we see at the department when we receive requests for technical assistance from the counties and other entities. I will say not all of these characteristics are required for a youth to be considered complex. There's a various combination of needs and characteristics that are occurring there. I will say that all of these children have experienced some form of trauma, whether institutional, abuse, neglect, developmental. They have all experienced some form of trauma. Many of them have multiple and complex diagnoses across the developmental, physical, and mental health domains. They have complex communication needs and have multiple system involvement, as Commissioner noted. Lack of diagnostic clarity. Many of these children go from clinicians to psychologists to psychiatrists in the community to hospitals. They're going around to all these different sources of help, and they're getting different recommendations, different diagnoses. And it's very confusing for not only the youth and the family, but also the systems trying to support them. And as a result of a lot of this activity, there's also an extensive history of out-of-home care. So these are the most often encountered characteristics. This is how we try to describe these youth with complex needs. Again, not all of these bullets are required, to really be considered a youth with complex needs. Next slide. This work started a few years before I came into this role. However, I would say it really gained momentum in the fall of 2020 when the department issued a complex needs planning bulletin. This bulletin is intended to give a channel for counties and other entities to seek technical assistance from the Department of Human Services regarding youth with complex needs and their families. That technical assistance typically looks like guidance regarding license settings, funding, referrals to clinical resources that we're familiar with, and successful strategies from other counties and regions of the state. Next slide. Following that, we kicked that effort off to provide technical assistance, and we started to gain an understanding of what was happening at the ground level. And we wanted to gain a little bit more information and knowledge on that topic. And so in 2022, December, we kicked off a series of focus groups and surveys with the ASSERT Collaborative through the Office of Developmental Programs to conduct a series of focus groups and surveys. That report is attached in the Blueprint Report as Appendix B, if you want to take a look at that. We surveyed and spoke with all of the child serving systems that touch these children. Justice systems, education, hospital systems, families with lived experience, behavioral health managed care, county administrators, mental health, IDA, child welfare, you name it, we spoke to them. And coming out of that report were 5 common themes, challenges, areas of challenge, and those are reflected on the next slide. Communication, services programs, resource navigation, staffing and workforce, and trauma-informed supports. Woven throughout all of those, echoed consistently by all of those focus groups and surveys, was family engagement, the importance of that throughout all of those themes. These 5 themes and the desired future state on the next slide were the guiding light for the next step, the Blueprint Work Group that was formed in July of 2023. Not going to read this to you, but this is essentially the vision for the work. That paragraph at the top, that's what we want to see happen. That's how we want to see youth with complex needs and their families served. The bullets below that are how we will see that happening, how we will know that it is occurring. Next slide, please. So we kicked off the Blueprint Work Group in July of 2023. That group was tasked with developing recommendations to improve outcomes for these youth and their families. And I want to emphasize here that the participants of that work group were really empowered to leave nothing off the table, to develop recommendations which address all levels of government and all systems of care. Slide. So you may be asking yourselves, who were the participants? It's a reflection of the focus groups and surveys. Again, behavioral health managed care, counties, education, hospitals, families. And from the state side, we also had Juvenile Court Judges Commission and the Department of Education, in addition to DHS staff. If you would like to see who all was participating in that, you can see that on page 4 of the report or Appendix E. Next slide, please. I want to draw your attention to 4 recommendations that were included in the executive summary. And these are pieces that the Blueprint Work Group members felt were important to pull out from the rest of the recommendations. Number 1 is an emphasis to restructure our systems to focus on prevention. And you'll see that echoed through some of the recommendations. Number 2 is that decision makers implementing these recommendations, yourselves, Secretary Arkush, and others from state agencies up to the governor's office, need to be consulting with families with lived experience. A steering team is needed to carry out these recommendations. No one wants another report, right? We want to actually move these things forward. So a steering team is needed to move these forward. And you'll hear about that as phase 2 later on in the slide deck. And also, number 4, very importantly, acknowledgement of the immediate crisis that you just heard articulated by the commissioner. The need for state, local, and system leaders to come together, find solutions, and to implement those immediately. Next slide, please. So these are, for the sake of brevity, I'm going to only address 6 of the recommendations as they're kind of organized in the report. So the first one is amending Act 212. This is the early intervention legislation, which provides for screening and tracking of developmental milestones for young children. We would like to, the Blueprint Work Group would like to expand those screening and tracking categories. Right now it's lead exposure, a stay in a NICU or PICU, homelessness, things of that nature. The Blueprint Work Group lists out several different screening and tracking categories which will help us identify these youth earlier on so that we can prevent that immediate crisis that we're talking about right now. Number 2, information sharing and resource navigation. The example I'm providing here is the establishment of a work group to examine our privacy laws, HIPAA, FERPA, our policies and implementing them across state, county government, across providers and different systems. We have to know who these children and youth are, their histories, from prenatal all the way up to the present day. We need to know who the families are, what their histories are, what their needs are. If these systems can't share information, then how are they going to make informed decisions about how best to support and treat them? Number 3, echoing that information sharing and understanding of the child and family is the development of a tool that can be used across child-serving systems that chronicles and contextualizes the child's history, their treatment needs, the family history, all of that. Something that can be used across systems. That's vitally important. Right now, systems use different tools, and they have different purposes. Next slide, please. Administrative efficiencies and supporting our systems. This next example is no surprise. We need to create strong incentives to build a qualified workforce to enter and to remain in human service fields. There needs to be significant effort put in this at this front. Providers, county government, we're all suffering this lack of staffing and retaining our folks that do this excellent work. 5, understanding system capacity and direct service solutions. This is, the example I'm providing here is the creation of a multidisciplinary team of professionals. This is a direct service at the ground level. A group of professionals in the community who can help prevent hospitalizations, prevent RTF admissions, prevent out-of-home placements. So we're thinking psychiatrists, psychologists, mental health professionals, nursing, folks of that nature. And 6, last but not least, strengthening trauma comprehension and application. Significant progress was made in Pennsylvania under HEAL PA under the previous administration regarding trauma-informed care and trauma-informed principles. However, there needs to be more and continued work to develop uniformity and consistency across systems. And so that's what recommendation 6 is regarding, is to try to continue that good work of HEAL PA. Next slide, please. Yep. So where are we? What are we doing with these recommendations? We have taken another work group, similar makeup. We have a broader group. If you look at bullet number 2, the associations are now represented to have that broader statewide perspective. We wanted the first work group to be the people at the ground level who are doing this work day in and day out to develop the recommendations, and now this broader work group to build out the details of that, how to actually make those ideas happen, make them actionable. Next slide, please. This Blueprint steering team cannot possibly work on all 18 of the recommendations at the same time. There's simply not enough capacity to do that. In addition to the 18 recommendations, we've partnered with the County Commissioners Association of Pennsylvania. We have taken their recommendations and folded them in And this Blueprint steering team is prioritizing some of that work. So you'll see workforce was the first recommendation that they're focusing on as a subcommittee. The second subcommittee is focused on a comprehensive needs gaps analysis. And the third is accept and provide, which is a different phrasing of the no eject, reject proposal by CCAP. So these subcommittees, next slide, are meeting monthly, developing these recommendations. There's a steering committee meeting quarterly and an advisory partner work group, which you all are invited to, which is meeting quarterly as well, following the steering committees. And that's an opportunity for us to provide updates to the broader stakeholder community, because we can't have everybody in the room, and seek their input as well. That concludes my report out on the Blueprint report. If I have time, I would like to spend just 2 seconds talking about the Pediatric Capacity Building Institute, if I have time. Okay, so the Pediatric Capacity Building Institute was launched in January of 2024. This is an annual in-depth educational and interactive opportunity for participants across child-serving systems. Again, the same participants who are in the focus groups and surveys, the Blueprint work group, it's the same systems that are represented as an audience. The goal is to increase the clinical and administrative capacity of all child-serving systems. It's a 9-month, 2 days per month opportunity here. Again, focused on youth with complex needs. Next slide. And that's just a taste of the curriculum. So you can see it's quite a robust curriculum that we cover over the 9-month span. We are entering year 2 in March of 2025. We're in the midst of refining the first year's curriculum. And that concludes my portion of testimony. Which slide would you like? The curriculum? Yes. Oh, the 18 to 21?
Yeah.
That's a typo. It's supposed to say 0 to 21. Someone reviewing it saw young adults, and yes, thank you.
Thank you. We'll now open the floor to questions of our panelists. We'll be joined by Brian Borman, Esquire Executive Director, Pennsylvania Children and Youth Administrators, County Commissioners Association of Pennsylvania, to answer any questions members may have. Chair Krupa.
Thank you to all the testifiers here today. This is a very, very important issue. In the CCAP written testimony, there was an indication that although I'm sure that they're happy to work with DHS, but they recognized that your approach to the problem was a little bit different, and there was an urge that attention be paid to the immediate crisis and the lack of appropriate placement as priorities. I know in community discussions that I've had with key stakeholders and families, juvenile placement, as you all know, is extremely hard. Juvenile placement for juvenile females, I've been told, is like finding a unicorn. So what is DHS doing to bridge the gap between the CCAP recommendations and the plan that was set forward today? What is DHS doing to immediately respond to this crisis?
Thank you for the question. So in terms of the collaboration between CCAP and DHS, Brian Borman actually sits on the Blueprint work group, and as I mentioned, the third recommendation is accept and provide. That is the discussion in that subcommittee regarding that no eject reject program development. So there are conversations happening about that, and I don't have a answer for you regarding the juvenile placement today. I know that there have been actions the department has taken of recent months and over the course of the past year. I can certainly get more information on that regard if that would be helpful.
Thank you. And the discussion today seems to be more in terms of treating the symptoms of this crisis. Has there been any studies or information regarding why we're in the position that we're in. Is it drugs? Is it the breakdown of the family unit? Why do we have so many youth that are considered complex?
So I think the commissioner addressed some of it at the beginning of her testimony. I think it was occurring before COVID, but I think COVID really was a major catalyst to a lot of this. But I think there's any number of reasons that could be driving this. Staffing and workforce is a major one. I understand from the provider associations, their risk and liability insurance for caring for and supporting these youth is a challenge for them. I think that there's some evolution happening that has been happening in all of our child serving systems for years now that has been leading up to this moment. Brian, it looked like you were about to chime in with something. Okay.
Yeah, I was just going to add that I've been doing this work a little over 30 years, and the cases have been getting more complicated, much like all the stressors in our modern society. But Don is absolutely right in that the workforce has really been an exacerbation of the problem. And for the providers, there's a number of challenges in terms of they also have the staffing issues, same as the counties do, and the liability insurance has been very dramatically impacting the ability to take these kids. In fact, in California, LA County was recently advised that they weren't going to be covered anymore. They couldn't purchase liability coverage at this point, and as another county-based system, we can only anticipate that at some point that will make its way to Pennsylvania as well. So it's just as a practical matter, insurers do not like covering these types of programs, so that's something we'll need to look at in the future.
And I guess my question was meant to be a little bit more broad than that in terms of, I understand the issue in terms of the lack of workforce to address the issue, but has there been any studies into why the demand has increased, how much it's increased, why in today's society do we have more children with these complex trauma, the multiple diagnosis? I mean, I'm sure that there are dozens of influences, but it seems like that at its core, we should be trying to prevent children from being in this situation in the first place. And I appreciate the early intervention programs, but it would be great if there were less children that needed that. Thank you.
Yeah, 100%. And the prevention is one of the major features that we really need to be looking at. If we can't stop what's coming in the front door, we're never going to be able to kind of catch up in providing the day-to-day care. And to that point, one of our recommendations was something along the lines of a kin connector or some type of information referral source. That the overall mental health system is extremely complicated, and for many parents, it's a real challenge for them to be able to get their kids the needed services. And as a result, we end up all too frequently that children and youth becomes kind of the mental health provider of last resort when the parents simply can't handle it anymore. And no parent should ever have to give up their child in order to get them the treatment they need.
Rep. Fleming.
Thank you, Madam Chair. It's great to see you all again. Having done work in this field as a child advocate, I really appreciate the work that is being done each and every day under conditions that are getting more and more difficult. We know in terms of workforce, pay is a major issue. Turnover in counties is a major issue because you can't retain. But I wanted to hone in on sort of the last point we talked about. Following the passage of the Federal Family First Prevention Services Act in 2018, that's when sort of the federal government got wise to the fact that, prevention, if we can do things to prevent kids from being in the system, we can, we actually have a chance to make sure the system isn't overburdened. So I really want to focus on that point. What are the concrete steps that we can take, and how can we as legislators help in that prevention? What are the things that we can do aside from early intervention and things like that on the front end to make sure we're identifying children that may be at risk and make sure that we can mitigate that before it evolves into a complex case or something like that. And if there's anything we can do, I'm happy to be helpful in that effort.
If I can take this one, thank you. The very first recommendation in the Blueprint report is the recommendation to amend Act 212. There is language provided in there to add new screening and tracking categories. If you can track those developmental milestones of these children, you may be able to identify youth who may have more acute needs later on, and you can prevent that. In addition to that, when early intervention services touch the family, even if the child is doing fine developmentally, they're still getting access to resources and referrals of other community services. They might need help with social determinants of health, housing, workforce, transportation, whatever it might be. So it's kind of a twofold aspect to that. But I would strongly advocate for assistance with amending Act 212.
Pardon me, just one follow-up. Does the department have draft language or anything like that? Is there a bill currently
we do not
drafted?
have, I'm sorry, I interrupted.
No.
We do not have language drafted yet. We would certainly seek your assistance in drafting that language. I had a preliminary conversation with the Pennsylvania Partnership for Children regarding some language. I think this is on their radar as well. Yeah. They have a different approach. I think their focus might be on maternal mental health, but it's all kind of the same ball of wax, if you will. And so there's certainly opportunity for us to collaborate and work together on that front.
Well, when you get to a point where you all are comfortable, please come see me. I'm happy to lead that effort.
Absolutely, thank you.
Thank you, Madam Chair.
Oh, thank you, Rep. Krajewski.
Thank you, Chair. Good morning. Thank you for being here and for your presentation. I just had a couple of quick questions. I know we're running out of time, and this is really going to be following up on some of the points Rep. Fleming made. One is just if you could speak a little bit more to just the workforce challenges and what is the scale of those challenges, because I know in meeting with county administrators about other issues that this is just a challenge system-wide around workforce, not even just with youth with complex needs. So maybe we can start there. And if you just can expound a little bit more about like what are the workforce challenges you're seeing on the county level?
Just for some point of reference, for 22 and 23, across the state, there was a net loss of about 300 caseworkers. And that's so throughout that time period, most counties were adding to what should be their complement because they really needed the additional workers. However, the net result was actually a loss and as a result, some counties have been running with 50 to 85% vacancy rates. It's impossible to really do the work with this hard. And I think coming out of that, a lot of folks are not real keen on going back. You can't do this type of work. You can't be a caseworker remotely. Mm-hmm. So there's some level of remote work possible for doing your paperwork, but ultimately you need to personally engage with the families in their homes and go to the doctor's offices and go to the CAC centers. Mm-hmm. So it's just not as appealing to the folks coming out of college now as some other options there are.
Yeah, no, it's hard. It's hard work. So thank you all for your commitment. And then my second quick question is just talking about the prevention piece, right? Because I think that I think the best way to kind of ease that burden is to have less children going through the system. And we know that children are not just born with complex trauma issues. They're created due to many socioeconomic factors. And so can you just speak to, from your vantage point, what are some of these foundational issues, whether it's housing insecurity, maybe it's poverty, maybe it's malnutrition, that lead to some of these complex trauma issues that then you all have to deal with at the point of impact? But as legislators, maybe there are ways in which we can affect some of these other larger structural policy areas so that children don't end up with these complex traumatic needs in the first place.
Thank you, Representative. And that is such an excellent question. And You know, everything that we do at the county is intrinsically intertwined, and I think that's a piece of answering your question. So our people will say, we have seen this child's parent here before. We cannot stop this cycle, and that's what really needs to happen. And I think about going back to 40 years ago when the government went, we're going to stop people from smoking, right? And it was a full-on blast to stop people from smoking, and it's working. And so this problem is not a problem that is fixed overnight, sir, not in any way, shape, or form. But when county mental health services are underfunded, and they are absolutely underfunded, I would be negligent if I did not beat that drum here today. Then we have adults that have mental health issues with children. We have children that have mental health issues, and they're not being treated. There's a level of trauma. When we have someone in prison because they suffer from the disease of mental health and they have children, there's another level of trauma. If you don't have a home, if you don't have a secure home, it's another level of trauma. And then there are other horrific things, right, that happen to children, right? And our schools are taxed. They are underfunded. I know I'm beating the drum in this room. But, right, all of those things have to come together to be a part of the fix. Brian and I were talking about Cumberland County, and Cumberland County pays its children and youth staff very well compared to other counties, right? It's very hard to compete. It's incredibly hard to compete. This job is so difficult. The things that people see are terrible. It's like our police officers. The things that they see are terrible. So this is a holistic approach. Like, I appreciate the questions very much, and I think they're very important. But if we don't get to the core of every single one of these problems, you don't just pick one and go, oh, I fixed it. We have to work on all of them together. We need your help. Like, I'm not giving you lip service when I tell you that. We need your help. Thanks.
Thank you. Rep. Schlegel?
Thank you, Madam Chair. I think really I just have a comment. You're certainly welcome to elaborate or make any comment as you might see fit. I'm always particularly interested in the staffing and the workforce aspect in so many career pathways, professions, walks of life. And it just seems to me in this day and age that we need to really focus on folks that know their stuff, care, and can certainly develop positive human relationships. And yes, credentialing, certifying, licensing is important, but I think if there's a better way, maybe a quicker way that we can figure out, if more the people that have those kinds of skills, get them into the workforce. It's the proverbial, you get good people doing good things, you get positive results that I think that you've talked about. So I certainly am always interested in how can we get that done in a much more efficient way than what we've done. And certainly the pandemic has maybe contributed to that. I think the rigidity that had been developed over time has helped to contribute to that. And I think it's really a matter of identifying the results, the preventative piece that you talked about, but also identifying who do we know, who applies for these positions, who can we recruit that has that skill level, and let's get them on the jobs and good things will happen. Thank you.
Thank you. Rep. Serrato?
Hi, good morning. I just wanted to thank you for your advocacy in this particular area. You know, I am by no means going to compare my own child with a child of this nature. However, I did experience a situation where we were evaluated in the MICU in preschool level. And unfortunately, we didn't quite hit the mark for services. But it meant that when my child went into school, she was wholly unprepared for what she was experiencing. The level of anxiety that then came with that was incredibly significant. and she was a COVID kindergartner. So as you can imagine, our first year in elementary school, we call for, testing to be done to get her evaluated because it couldn't be done in preschool. And now we have this, the entire world shutting down for COVID. We can't find a therapist. It took years and years of being put on wait lists. They didn't accept our insurances. I have 4 children. The cost involved to try and find a provider that would help was astronomical. My very first bill to be signed in my first session is a mental health licensure bill for social workers and marriage family therapists, creating an associate license to try and make it easier for people to get into that workforce. But it is something that even without having a complex issue with a child, I've seen firsthand. It's something that we really do need to work on because it can escalate so quickly from a child just not getting what they need, not being able to turn anywhere. And as a parent, I'd like to consider myself an intelligent human being. I'd like to say that I have enough resources and connections to try and find help. And I struggled. I can only imagine someone who is socially or economically stunted as an adult who has their own issues trying to fight tooth and nail to get their child help and feel like they're losing ground at every. So I just want to thank you for your efforts. Know that you do have people here in the legislative body that know how important it is and that we can make a change. And we're here to partner with you. So when you do have ideas, please come to us. Please let us know. Not one of us can fix this on our own, but together we all can. So thank you very much.
Thank you. I want to take the time to thank all of you who shared your results of the CCAP Complex Task Force Report and the DHS Blueprint Report. I appreciate your efforts that you have taken to raise awareness on the complex needs of youth in our Commonwealth and outline the importance of improving mental health services and child welfare departments to better support and serve our youth. Chair Krupa, do you have any closing remarks?
Thank you, Chairwoman McNeil. I just want to thank the testifiers and to echo the gratitude for your advocacy on these issues. They're extremely important issues, and we will look forward to moving forward with you.
If there's no further discussion, I entertain a motion to adjourn. Rep. Serrato, is there a second? Rep. Benst, we stand adjourned. Thank you.